And then I talk about, and I think this is also something that I continue to use today, is about we talk about social capital, right? Like when you talk about social capital, there are three types of social capital. One is the bonding capital, which is something that is like that brings a community together. And then there's bridging capital, which is connecting different communities of similar together. But then the third one, most important one, is the linking capital. Linking capital is one that connects these smaller communities to people or organizations in power. So the bonding capital, however strong it is, cannot help communities survive when there is a crisis unless they have that active linkages to people or organizations in power that provide them that resources, money, or help or guidance. And in the Peda Jalaripeta case, there were like two different times during the slums where they were able to tap into their linking capital and get some resources to survive the challenge. Without that linking capital, that community would not have survived. And I think that is something that we see here in US, is like when communities are struggling, and if they are able to connect or tap into some resources at a federal or a state level, that is when they overcome the challenge and survive it.
Yeah, I like that a lot, and I think it begs the question. So before I ask you, like, how does this translate to public health work? Maybe some of the public health work that you have done in your life. Like, how did you get to the point that this was the research that you wanted to do, or this was the research that kind of sparked interest for you?
So that when we go to public health and planning, I think they're so interconnected, right? I've kind of think that the urban planning is one of those unique field where everything comes together. Like a lot of those social determinants of health that you're talking about in public health are essentially urban planning. Like, that is the transportation, that is the housing, that is the community development, the economic resources, all of those pieces are under the urban planning framework. So in many ways, I feel like I've stayed in my planning space, but public health is what's come into the planning space with the social determinants of health and that focus on that piece. Because now there is more emphasis on, even the federal organizations are coming to realize that a lot of these health issues are kind of coming from this community challenges, because these communities have been abandoned or under-resourced or under funded for so long, and then now we are seeing the impact of those underfunded and under-resourced communities and what it is, how it is impacting the health of the communities. So yeah, they are very, very interlinked, and I think I've seen it in Peda Jalaripeta and how the communities that are close-knitted are taking care of each other and are able to demand more from their government or more from their people in power. They tend to get more support. So there is a lot of power in community building, but then there is also that aspect of linkages. If you're not able to connect to people with power or resources, then we end up with under-resourced communities, which results in huge public health issues.
Right, and this was like a very hard through line in the National Public Health Week conversation that we're having, just like how urban planning is just so linked to public health, to the environment that we're in, to how we interact with the environment, which causes a lot of the social challenges, the social benefits that come to certain communities. And we're talking just about how it's so important to have a public health lens, or to just think about how can we create equitable and healthy environments planning so that communities can really thrive. And I think back to like the meeting I just drove into before this conversation, is that they were city planners talking on a panel and talking about like food systems and talking about how they play a role in the food inequities, and how do we create better systems, better planning, better communities where people can really access healthy and affordable food. And I think it's just good to know that like this urban planning public health is so vital. And I think it's good that we're having this conversation and continue to have the conversation, so that we are creating urban planners that are doing more Health Equity Public Health Week.
Yeah, and I think it's also important that we learn from what happened previously, right? Like, if you look back in urban planning, we talk about some of those federal and state policies like redlining or blight, or like, or highways that were built and divided the communities. So those were all under the urban planning umbrella. But now we can see that those are the same communities. Those are the zip codes that have 20 years lower life expectancy than the zip codes that were not untouched by those highways. So these things did not happen in a vacuum. Like when we talk about food desert, it's a misnomer, because deserts are a naturally occurring phenomena, but these are very systematically created places that were under resourced. And so I think it is important to have, because these problems are such wicked problems, so they're like multi-layered, multi-textured. So unfortunately we tend to focus as a field very become more and more specialized, but a lot of these challenges are where these intersections happen. So I think if anything, we need to have more of these conversations and thoughts, which are at much level, like at a 40,000 feet level, looking at its intersectionalities.
And I also like the point that you highlighted, like, so the historical context of it, like, how redlining came into play, and then that created the urban planning mechanisms where they started to build highways in communities of color, in impoverished communities, and now today we see those same communities suffer from stresses of that, the pollution, the asthma, all these different things. So I think it's really good to center that and know that while there is the possibility for positive community development, urban planning, historically it has been something that has been used to create it has created disparities in many situations.